Good afternoon. I'd like to welcome and introduce Dr. Robert Murphy, Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine, who answers your COVID questions every Wednesday on the Havey Institute for Global Health's Facebook page. Today, Dr. Murphy will be answering viewer-submitted questions and addressing the latest COVID headlines through today, January 25th. We invite you to submit your COVID questions on Facebook or at any Institute for Global Health or by email at globalhealthinstitute@northwestern.edu. Leading the discussion today is myself, Sophie Bukowski, a student research assistant with the Institute. So Dr. Murphy, I'm going to start with some updated COVID statistics.
Thank you, Sophie.
In the United States, yesterday we saw 45,656 new cases, with our 7-day average at about 60,000 positive new cases every single day, which is it's increasing and decreasing on a weekly basis, but it's staying about the same. Hospitalizations have decreased by 25%. The death rate has decreased by 7%. Our daily average deaths is about 542. Illinois is not tracking weekly cases, but what we are seeing is that hospitalizations are decreasing by 33% and the death rate is increasing by 39%. So what can you tell us about what is going on in the United States with cases going up and down every single week?
Yeah. Well, they're mostly going down, and this is happening worldwide. Different parts of the world going in different patterns, but in general, it's coming down. And so what the numbers you're stated are indicative of the fact that the winter pandemic, the winter peaks and bubbles are pretty much coming down. We're over that peak after the holidays. And depending on where exactly you are in the world and what the temperature is and so forth, depends on the number of cases. So flu and respiratory syncytial virus went down first, and COVID is drifting down as well. So we're down we're going in the right direction with the number of cases. The death rate is still over 500. But remember, the death rate and the hospitalizations days, not the new hospitalizations, but the people in the hospital, always lags the cases. So you get exposed, you get sick, you get real sick, you end up in the emergency room, and some people in the hospital, and then some people in the hospital go in the ICU, and then some people pass away. So the effect on the death rate is the last thing to really change. So it'll be very interesting to see when that drops back down into the 300s, but we expect that will happen because the cases are now down. So that part will catch up. And we've learned another couple things in the last few weeks where two sort of things happen. One is that the Israelis, who have a smaller population, more homogeneous, kind of centralized healthcare, everybody getting vaccinated very closely at the same time. They have shown that the new vaccine, the bivalent vaccine from Moderna and Pfizer in particular, work really well. They work better than the original boosters. So that's a really good thing. They're like a sentinel group. They're always a couple months ahead of us. We'll see that same kind of phenomena here to the extent that people are taking the vaccine. But as you mentioned, there's not a big uptake in the new bivalent vaccine. Not even almost a third of people have taken it. So, and then another thing that happened in the last week or so is that the people with hybrid immunity, so that's people who've taken the new booster and also had COVID sometime in the past year or so, they do even better than anybody. So if you've had COVID and you've had the bivalent vaccine, you're up to date on everything. These people are doing really well, even people that are older.
Yeah, no, absolutely. Well, going into our first COVID headline, sewage from planes is a key COVID tracking tool. Reports are now saying as CDC talks to airlines about wastewater testing. What can you tell us about this? This is new for a lot of people that this has been going on.
Yeah, so they've been talking about and have been doing wastewater detection for quite a while. And they started looking at the airlines, and it's basically everywhere. Now, the thing is with the PCR test, which is the test that they're using, remember that tests like microscopic fragments of the virus. So people can shed those particles and the test will be positive for many weeks or months, and in people who are immunocompromised for many months. So it's not too surprising that those tests are positive. It'll be very interesting to watch and see if those cases actually ever go down. I think that would be a really good sign that the infection would be far behind us. But certainly it's not the case right now. There's so many people that have the infection, even those that are vaccinated.
Yeah, absolutely. And then going into our second headline, the FDA says COVID vaccines will probably get an annual update, but most people will likely need only one shot. So, what is going on with the FDA and what are they approving this week?
Yeah, this actually caused quite a bit of controversy out there. A lot of debate back and forth, if anybody knows what they're talking about. And that, so the FDA and CDC have come out and said, oh, you're probably going to need a new vaccine. And so they're tying it up with the flu vaccine. So, the flu vaccines come out in the fall. And they're thinking that the same thing will be for COVID. Now, remember, though, COVID is not a seasonal infection. Like, remember Delta? That started in August, the high summer month. So, but the big problem is all these respiratory infections that come every late fall and winter. So it's kind of a schedule of convenience more than anything else, and it remains to be seen whether it really makes a big difference if you get a vaccine every year. With the data that we're seeing with the bivalent vaccine, it's certainly looking like it works better. This virus keeps evolving. And so why is the new bivalent vaccine working better? It's because it's designed to go after Omicron, and the original vaccine was, the original virus was much different than Omicron. So, if this evolution keeps happening, it's likely that the vaccines will be tweaked every year. If it doesn't show any benefit, maybe it'll be every other year. Who knows? We don't know. We're in kind of a territory that we don't really know, but I think it would be fair to say, with the number of infections, with the way this thing mutates, that you're going to have to change the vaccine at some point. And I think the only question really is when. And I think I agree with the CDC and FDA at this particular point, with the information that we have, that throwing it in with a new flu vaccine every fall would be, I think, probably the best bet. I mean, it's a guess, but and we'll figure it out at some particular point. But at least it's not like, oh, you got to get a vaccine every 12 weeks or whatever. I mean, that would be really tough because people aren't even taking the new vaccine, and that's been out since September. So it's just likely that an annual vaccine with COVID at the same time you're getting the flu vaccine, or at about the same time, is probably going to be the way to go.
Wow, that's so interesting and is so different than what we've been hearing for so long.
Yeah.
Well, going into our last COVID headline is that the US life expectancy is in decline. Why aren't other countries suffering the same problem? I'm going to share a graphic now.
Yeah, show that figure. The United States is really an outlier among its peer countries. And you can see here that COVID just made the situation worse. But life expectancy in this country is going down. We peaked, somewhere between 2012 and 2018 at about, close to 79 years being the average life expectancy, and we're down to approximately 76. So that's a 3-year drop, and it's still going down. And none of the other wealthy countries are showing this pattern.
Yeah. I'm going to
And
pull up the other graphic, Dr.
yeah,
Murphy.
show up the other graphic. So this graphic is wealthy countries and life expectancy. So along the bottom axis there, the x-axis, you can see gross domestic product per capita. This is how you measure wealth. And so, the United States is a wealthy country, but GDP, it looks like it's approximately 65 or so $1,000 per person. The only wealthier countries really are Norway, Switzerland, Ireland, and Luxembourg in this group. And you can see the income of the other ones. And then on the y-axis, the vertical axis on the left, you can see this is the life expectancy. So in this graph, the figures are different from the last one, but the way they collect it. But you can see kind of where you fit in, where we fit in relative to the other countries. So we spend a lot. We have money, and we're a wealthy country, but our life expectancy is low, much lower than countries even like Turkey, Greece, South Korea, Japan, United Kingdom, and all these other countries are, they are living much longer than we are. And there's many, many reasons for that. It's not just one thing, but COVID is part of it. Drug use deaths is another part. Poor healthcare in many of the communities in the United States. There's a multitude of factors. So you put it all together, and we're not on the right course, and we have a lot of money. So there's something really wrong here. It's not, money is not going to solve this particular problem. We're already a high income country, very high income. And, we got countries with a lot lower income like Turkey that are actually doing better than we are. And almost all the European countries are doing better. If you take the top 20 of those countries, we rank 20th in terms of life expectancy. And we're going down, and they're flat or going up. So it's something that the public health authorities have to really try to address. Are we going to just keep dropping down? And there's certain populations within the United States that are, that's the average. So if you can find groups that are doing even much worse, and it's a trajectory that is not good, and we need to really work on that, and hopefully convince people to lead healthier lives and to get healthcare equity, going throughout the country, so that everybody's got access and can benefit from all this wealth that we have.
Yeah, absolutely. Well, going into our only COVID question is there an increased risk of strokes when getting the Pfizer vaccine, Dr. Murphy? What can you
Yeah.
tell us about strokes and the Pfizer vaccine?
So there was a report several weeks ago looking at the new Pfizer bivalent vaccine, the new vaccine, and there was a report that there were more strokes than originally expected. However, when you actually look at all the data, that number is actually about the same as the number of strokes that were measured here were the same before the vaccines were even introduced at population. So the number is actually not higher than what's expected compared to our historical controls. The other thing to keep in mind is that strokes, heart attacks, and all sorts of other complications are much more common with COVID than people that don't get COVID. So there's a trade-off there. If you avoid the vaccine and you get COVID, which is very likely, your chance of having a cardiac problem or a stroke is much higher.
Yeah, well, thank you so much, Dr. Murphy, for filling us in today, and we will see you next Wednesday.
See you next Wednesday.